Assalamualaikum warahmatullahi wabarakatuh. I will present my paper with the title The Adolescent Perception Correlated with Access to the Source of the Reproductive Health Information by Dewi Puspita and Lutfi Anindita. Introduction. Data from the Ministry of Health of the Republic of Indonesia in 2015 contain 1,189 adolescents aged 13 until 19 years who claim that they have experienced unwanted pregnancies. The cause of this incident was due to the lack of knowledge of reproductive health in adolescents and access to appropriate information sources. Reproductive health is essential to prepare adolescents for changes in their physical and psychological aspects. The knowledge about reproductive health accessed by adolescents from various sources, such as the internet, parents, peers, and other information, can increase the knowledge and insight of adolescents. This information will also lead an adolescent to various perceptions about reproductive health. This study aims to identify the relationship between perception and access to sources of information in reproductive health in adolescent. Result. This research was a quantitative study that used a descriptive correlational design with a cross-sectional approach. The subject of this study was 93 male and female adolescents. This research was conducted in Lemah Dadi village with the adolescent age ranging from 13 until 16 years old. This study used two variables, namely perception of reproductive health and access to information sources. Table 1. Characteristic of respondent based on age and gender. The respondent age was mostly 16 years old with a total of 29 people or 29.0%. The most dominant gender is female with a total of 49 people or 52.7%. Table 2. Perception of reproductive health. The perception of reproductive health is in bad category with the total number is 51 respondents or 55.8%. Table 3. Access to information sources of reproductive health. The access to information sources of reproductive health is the internet category with the total number is 62 or 66.7%. Table 4. The relationship of perception and access to information sources of reproductive health. The relationship between adolescent perception and access to information sources was obtained at p-value 0.029, indicating that there is a significant correlation between perception and access to information sources. Discussion. Age. This research is supported by Fatima 2006, which states that the 60-year-old adolescent would encounter various kinds of development, one of which was social development that led them to learn relationship with other people, including peers. Gender. Male and female have differences in curiosity. Young males have high curiosity, tend to want to act aggressively, and dare to try things that have never been experienced. Female tend not to dare to try everything they have never experienced before. They are more secretive in discussing reproductive health as it is a personal problem, and it can make them think positively about reproductive health. Gender differences in viewing reproductive health can affect the perception of adolescents by Abul-Jabab and 2016. Perception about reproductive health. There were 20.2% of adolescents who did know that the discussion of reproductive health was extensive, as evident by the result of the questionnaire, where adolescent answers agreed that reproductive health only discussed genital. Students frequently access information about reproductive health from various sources that are not necessarily accurate, and they still have different knowledge of the information that they obtain. By Lukmana and Yuniarti at 2018. Access to information sources of reproductive health. The most widely used access to information sources of adolescents to find information about reproductive health is the internet, with a total of 156 respondents or 87.15% by Dewi Janitra Aristi and at 2018. It is because the internet can be used anytime, anywhere and by anyone at low cost, and there are many ways to access it. Thus, it can be a strong position in the mass media that it first excited, and the public response to the internet is very enthusiastic, especially by adolescents. By Ayun at 2015. The relationship between perception and access to information sources. Based on the hypothesis, the result of the p-value are 0.029 with p-value less than 0.005, which indicates there is a significant correlation between two variables, the perception of adolescent and access to information sources. The correlation coefficient value is 0.227, which indicates that the relationship between the two variables is weak, and the correlation coefficient value is negative, which means that the higher the access to information sources is, the worse the perception will be. Knowledge of reproductive health in adolescent age 13 until 16 years old essential to prepare adolescents for the changes that occur, either physical, biological, and psychological changes to prevent a wrong perception. The factors that affect perception are gender, knowledge, education, and experience by Nur Al at 2018. The availability of the internet for adolescents not only provides benefit for adolescents but also harms, which can be destructive, such as porn sites and free resting among them. There is a positive impact that can affect adolescent knowledge, especially about reproductive health, if the adolescent use the internet wisely for their needs. Samidah 2017. Conclusion: adolescent perception about reproductive health, which was in the good category, were drawn by 42 respondents, and the bad category were drawn by 51 respondents. 2. Access to the source of information was drawn most significantly from the internet, with a total of 62 respondents. Access from friends was drawn by 14 respondents, and parent was drawn by 17 respondents. And there was a relationship between adolescent perception and access to information sources about reproductive health, with a p-value of 0.029 and a value of R 0.227 negative. Recommendation for nurses: they can increase their role, especially in carrying about community service and making work programs to increase knowledge about reproductive health in adolescents at community services. For the Educational Institute, the study can be used as a discourse to create the PIKKRR, Center for Adolescent Reproductive Health Information and Counseling in School, as a forum for adolescents to access information and counseling on reproductive health. For further researches, they can be conducted by using a correlative method concerning the factors that influence perception, such as age, gender, knowledge, and experience. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.